Today, we'll be talking about the most prevalent but neglected illness of our country, that is anemia. And we have today with us Dr. Tuhin Pal, who is the eminent pathologist of Kolkata and the faculty member of Calcutta Medical College and Hospital. Dr. Tuhin Pal.
I would like to point out some key statistical figures which are available with us. These are the latest WHO figures which are showing that as per the 2017 data, the nutritional anemia is widespreadly prevalent in India, and in fact India lies at the bottom of the pit with the majority, 51% of Indian women, they are found to be having a nutritional anemia, which is the highest number in the world. To enumerate the various causes of anemia, and also more than that, I would like to highlight some basic yet scientific testing which are done by cell counters, automated cell counters, that are a very novel approach to a diagnosis of anemia. Now, whenever we think of anemia, the common person has a perception that, okay, anemia, so we have to do lots of testing and I have to go to a physician, huge amount of money will be spent, and after that the treatment will start.
That is very excellent. When doctor, you want to mean that anemia, in fact, in our country, is very large concern, a serious concern. This is number one.
Definitely.
Number two, you want to say that there are methodologies and the modern techniques are available, but still it is a low cost.
Sure.
And affordable by all, which is very important for all strata of the society. In economic terms.
Exactly.
That everybody cannot afford the high cost test, but you can get it in a very low cost, yet scientific, yet modern, and yet highly accurate.
And it will be acceptable to all the physicians also.
It will be.
And also in a resource poor setting like India, this will come as a huge boon, I think, to the common people. These kind of tests, these are the need of the hour. So
it's actually I think it is you want to mean an approach, a low cost approach, which is very suitable for India. So you want to provide a solution which is modern yet low cost, right?
Yeah.
Excellent.
And that will have an impact on the society as a whole. Because as I was telling in the initial part, anemia is a major disease burden, but it is neglected. More than 50 to 60% of children as well as the reproductive age group women, they are anemic, but they don't know yet. It's only in the somewhat urban setup that one may find the detection rate of anemia is a bit more, but once you go out of the urban setup and go and venture into the rural background, there in fact anemia is rampantly prevalent. So
now, Dr. Tuhin, I have just catched a very important one, probably word, that is reproductive age of woman.
Yeah.
That means if an
that
anemic
means 50
woman,
to 49 years roughly.
I mean that is where if that reproductive age is suffering from anemia, means there is a chance of affecting the children also.
Yeah, definitely.
So mother along with child is going to be affected. Yeah.
So the our main point of impact of any health program for the correction of anemia is targeted at these two populations. They are vital populations of our society. So now I would like to come to the specifics. Before the advent of the cell counters, the automated cell counters, the type of anemia was largely done on a peripheral blood smear by reticulocyte count and a complete blood count, as we all know. In fact, in the rural setup, it is still being done in the same way. But after the advent of the automated counters in the 1980s and 90s, and after the gradual improvement of those counters, now we are into the fourth, fifth generation counters, which are vastly superior. And the basic parameter which have changed the game is a term called RBC distribution width. In short, it is RDW. So this has changed the entire. This is a game changer.
RDW.
Yeah, this is a
What
game
is the
changer.
full form? What is the full form? You
Red
say?
cell distribution width.
Red cell distribution width.
So this actually what it tells us is in a nutshell, it tells us that what type of red cells, whether it's the smaller cells which are microcytes the normal cells, the normocytes, or the larger cells, macrocytes, what is the individual proportion of those three types of cells in a population of RBC present in the blood. And it does so in a graphical manner. So it does, and it's expressed either as a standard deviation of a normal population or as a coefficient of variation, CV. So like usually the normal range is around 11 to 14.5%. So when we cluster this RDW with another very important RBC indices, that is mean corpuscular volume, that is MCV. So when
corpuscular volume,
MCV. So when we cluster these two, and with the help of these two parameters only, I'm talking about only these two parameters. There are lots of more.
One is RDW, another is MCV.
Yeah.
RDW and MCV.
Okay. So with the help of these two parameters, we can actually, in a simpler way, in a rapid manner, we can predict the outcome or the type of anemia and what type of treatment, what type of further testing it needs, and we can channelize, we can steer the physician to go into that part of the disease, so that lots of unnecessary testing of various parameters which are done blindly currently to find the root cause of anemia, that can be avoided if we just follow these parameters.
How we get these two factors?
These are readily available in any good automated cell counters. These two, they are machine read parameters. We get it from the machine itself, and with the help of this, even before seeing the blood smear, even before getting any other parameters, because RDW, this parameter is so important because it changes even before every other change are evident on the blood film. Like a patient having a nutritional anemia, so first thing that will change in his blood testing is the RDW. So we can detect it early also.
Now, what I want to mean is that as you told about two parameters, RDW and MCV, means suppose a sample is collected from the patient, and that probably always we will collect the whole blood, right? So blood is drawn from him or her vein, and that blood sample is now run in a automated cell counter. So we get 15 to 18 parameters of it, right? I mean, whenever you run a sample,
we get lots of parameters.
We get at least 18 parameters. And on that parameters, when it is tested, when one run will give these 18 parameters. A single run means just it is drawing the blood sample, testing in the machines, and 18 parameters. Out of these 18 parameters, there is two parameters which is always we are getting. So for better understanding of everybody, we want to say that as the blood is drawn and it is tested, we shall see in the machines. We shall go to the machines and we shall see that how it is run, and in the screen we shall see how it is coming. I mean these 18 parameters, and then we shall mark these two parameters, RDW and MCV.
So, as I was explaining earlier, this is the 5-part cell counter I was talking about. This is fully automated machine, and it gives a differential count as well as a variety of RBC indices, as we will be seeing it shortly. And this is the monitor on which all the results are being displayed. And so we will just take a fresh sample in a standard ECG vial like this, and we will run it and see what happens. So as you can see, the sample is being sucked through this tube and it has entered the machine. Now the entire process is automated, and we will soon be seeing the results on this monitor. So now, as we can see, the report has been displayed of this particular sample. All these are the parameters, these are the WBC parameters, and these are the RBC parameters I was talking about. Now we are interested in these two parameters. The second one from the top, MCV, that is the mean corpuscular volume, and this one RDW. It has been given in two forms. One is CV, coefficient of variation, and one is FD, standard deviation. For our convenience, we usually use the RDW CV method. So as you can see, this particular patient has an MCV of 87.7 and RDW CV of 13.2%. So as per this parameters, both of them are within the normal range. So this patient is not an anemic patient. So in this way, if those particular parameters were out of range, by noting down the range of the MCV, the range of the RDW CV, we can fairly accurately predict the type of anemia, whether it's a nutritional anemia, where it's a beta thalassemia, or anemia of chronic disease, all the various types of anemia and subtypes. We can accurately predict that what type of anemia this patient is suffering from. That's it.
Thank you, Dr. Tuhin Pal, to be with And Health today. And I am thankful to my viewers. If you like this video, please give your valuable comment and please subscribe. Thank you.